welcome to University Television Presents. I'm your host, Jamie Bingham. Today my guests are Mistie Tolman, who has recently taken over as the new Public Affairs Manager for Planned Parenthood in the Northwest and Hawaii, and Michaela McQuilkin, the Boise State Generation Action Vice President. Within Tolman's new role, she manages programs in Idaho through legislative advocacy, civic engagement, and political campaigns. Generation Action is a group made of young activists across the country who organize events in their campuses and communities to advocate for reproductive freedom. I would now like to welcome my guests. Hello, thank you for joining me today. I would love it if we could just start with a little bit about your background and how you got into this position, a little bit about your jobs in the organization.
Sure, thank you so much for having us. We're really excited to be here. So like you said, my name's Mistie Tolman, and I did recently just take over as Idaho Legislative Director and Public Affairs Manager for Planned Parenthood Votes Northwest and Hawaii. I've worked with Planned Parenthood for about 4 years, and before that I worked alongside Planned Parenthood working for LGBT rights in the state of Idaho.
Awesome. Yeah. And my name's Michaela McQuilkin, and I am a social work student in the senior program at Boise State. And I started off with Planned Parenthood as a volunteer, participating in service learning at Boise State, and then as a part of my internship I became really involved with Mistie and Planned Parenthood Votes Northwest and Hawaii, and kind of took on that leadership role within Generation Action at Boise State, which is how I became Vice President.
Awesome. Well, let's just start a little bit about how Planned Parenthood started and how did it first begin?
Sure. So Planned Parenthood of Idaho began in the 70s, and then in 2009 we actually merged with Western Washington and Alaska to form Planned Parenthood of the Great Northwest. And then in 2015 we merged again with Hawaii and became who we are today, which is Planned Parenthood of the Great Northwest and the Hawaiian Islands. And then alongside that growth, our political and advocacy arm, Planned Parenthood Votes Northwest and Hawaii, grew into an independent, nonprofit, nonpartisan organization that educates residents and policymakers on reproductive health care issues in Idaho, Alaska, Washington, and Hawaii. It's notable, I think, to point out that in October of last year, Planned Parenthood as an organization celebrated our 100-year anniversary, and that was really a huge milestone for us and a celebration of the care that we provide and have provided for 100 years for women and men and teenagers, and we're going to be here for the next 100 years providing that care.
Awesome. And so starting a little bit what's going on right now with the presidency, we got a new president in office. There's been women's marches all over the country, and there was one in Idaho. Were you there? Can you talk a little bit about that?
So I think we can each take a piece of that question. I actually was able to go to DC for the Women's March, awesome. And it was one of the most amazing experiences I've ever been able to be a part of, to see that many people coming together for a common goal and to really uplift the voices that are going to be affected by this new administration. Mm-hmm. When we were in the middle of the march, we couldn't get cell phone access because there were so many people using the towers. So it took a little bit for us to get out to kind of where the metro stations were before we were able to get cell phone access again. And I started getting pictures of the Boise March. And the group I was with, we all just started sobbing at the metro station because to see so many people show up in Boise was such a moving experience for us. And Michaela was actually here and a part of that.
Yes, yeah, I was a part of the march, the Women's March here in Boise, and it was really inspiring, like she said, to really be able to uplift the voices that are going to be affected with the things that are happening currently. And I think it was really great for us to unite, and it was really great for all of us to kind of march forward and show that we're going to support one another and be there for one another when things get tough.
And you mentioned things are changing, things are getting tough. Can you talk a little bit about that and just maybe what Trump is kind of doing to change things?
Well, so I think it's really important that when answering that question, that first we remember how much progress we've made under the Obama administration. So under President Obama, we have seen, historically low rates of teenage pregnancy and historically low rates of abortion. 20 million plus people have access to health care because of the Affordable Care Act. And 55 million women now have access to birth control because of campaigns that Planned Parenthood led. So we've made enormous progress, and that kind of also makes us really hyper aware of what's at stake right now. this new administration is definitely on a crusade against reproductive rights, and not just a crusade against reproductive rights, but against Planned Parenthood specifically. And I don't think it's an accident that they're coming out of the gate attacking Planned Parenthood specifically, because by attacking Planned Parenthood, you're attacking a whole host of people, right? You're attacking LGBTQIA communities, you're attacking Muslims, you're attacking immigrants, you're attacking people of low income, people of color, environmentalists, right? Because these are all the different intersections where we all kind of find common ground. None of us live single issue lives. And so that's actually also the kind of happy side. The flip side of that coin is that because of those intersections, this is where we can come together and band together and find that commonality to come together and really stand up and fight back.
Mm-hmm. Do you have a comment on that?
I think that everything she said is right on point with what we're feeling as an organization, and also what I think our students at Boise State are feeling. We're definitely connecting with great groups on campus that also see the same mission or are fighting for the same mission that we are. And it's really great that we can bring students that represent the refugee community, that students that represent the immigrant community, and also students that represent the fight for equality. We're all coming together and are really trying to push forward.
And you mentioned, what's happening now, what's going to happen in the future. What hurdles have you had to face in the past to kind of get you where you are now?
Well, Planned Parenthood has really been under attack from all fronts for 100 years. I mean, literally from the very first days of the organization. We'll continue to fight for the next 100 years to protect access to reproductive health care. We're currently on the forefront fighting against bad bills, fighting against executive orders and regulations that are aimed at preventing women from being able to make those personal, private medical and healthcare decisions. We're under attack often from opposition groups, organizations who claim to provide reproductive health care and yet don't offer their patients a full range of services and choices. At the same time, we're under attack from legislators who will stop at nothing to restrict access to safe and legal abortion and reproductive health care. Mm-hmm. I think the bottom line here that I really want to make clear is that across the nation, Planned Parenthood is in the state houses and in the courthouses fighting to protect access to reproductive health care. Mm-hmm. And that's not going to stop. And at the same time that that's happening, we're also providing quality, non-judgmental care to our patients at our over 650, health centers across the nation. We're not going anywhere. We care about our patients and we want to be able to continue to provide that health care for them. Mm-hmm. Locally here in Idaho, I'm sure that you hear of the slew of anti-choice legislation that kind of gets floated around the State House every year. And this year, we even had a senator from North Idaho who wants to make abortion a first-degree murder offense with no exceptions for rape or incest. Mm. That's kind of an extreme example, but it's a type of these bills that we are on the forefront fighting against every single day. Mm-hmm. At the same time, we also have the opportunity to partner with our reproductive health care champions in the State House, these legislators that stand with Planned Parenthood time and time again, to introduce good legislation, proactive things that will help women, that will help protect access to reproductive health care, that will help prevent the need for abortion by expanding access to birth control and things like that. And in 2014, we had more proactive pieces of legislation introduced that year than in any of the years in the quarter century leading up to it. Mm-hmm.
Do you find it's hard to get this legislation passed in a red state like Idaho? You also mentioned Alaska. That's where I'm originally from. That's also a red state. But then, the Northwest, it's also Washington and Oregon. So have you found any complications with that being a red state?
It's always a struggle in Idaho. The silver lining of that is, I think, even legislators become shocked at how many people stand with us when they start to try to trample on these reproductive rights. We have women show up in massive numbers for the march in Boise, like you talked about. When they try and bring some of these extreme bills forward, we have women come out and march around the State House, come out and testify at hearings. They're sending letters and making phone calls and really standing up for their own rights to be able to make these choices for themselves and be able to live their best lives.
Any comment on it being a red state? Do you find that's hard as a student as well?
I think it's important for everyone to be able to voice their support and to voice possibly their opposition. And I think at Boise State University specifically, students have a great platform to be able to support Planned Parenthood. And I think that within being a red state, sometimes there is false information that gets out there. And I think that's really great for Generation Action to be able to ensure students on campus that we're going to provide them with medically accurate information.
Right. So talking a little bit more what you're doing on campus, what services do you provide for Boise State students?
Yeah, so as an affiliate, we have over 88,000 people come through our doors every year seeking to access life-saving health services, things like STD and STI screenings, cancer screenings, family planning and birth control. And in addition to these wide range of services, we also at our Boise clinic just down on State Street offer primary care. So we're doing cholesterol screenings and diabetes screenings and prostate cancer screenings and testicular cancer screenings and smoking cessation and offering a wide range of primary care services there as well. And all of these services are available to our Boise State students and the broader community. In addition, we do have a growing presence on campus with our student group, Generation Action, and they're doing a lot of really, really great work. And I thought I'd let Michaela talk about what Gen Action has been up to.
Yeah, so lately this year we really want to be able to increase access to the information, medically accurate information that Planned Parenthood provides, and really want to be able to mobilize and educate students on their choices so that they can continue to lead those productive lives as students, and then after they leave Boise State as well. And in order to do that, we need to make sure that they know what birth control methods that are out there for them, also how to protect themselves from STIs, and also how to communicate with their partners and their healthcare providers about sex and about STIs and about birth control methods, and really how to lead successful lives with one another in our communities. And so we just had our first sex ed workshop with our health experts from Planned Parenthood, Roats Northwest in Hawaii, and we had that specific workshop to discuss birth control access, what they can get from Planned Parenthood. If they can't access Planned Parenthood, what's the closest resource to campus that they can access those services? And we had a great turnout, and we're really excited to continue with these workshops. And our upcoming ones are going to be specifically regarding consent and communication, effective strategies to do so, as well as protecting yourself from STIs.
So is this workshop only for students?
We have had it open to anyone who wants to come. If students have family members and friends that really need access to this information, they're more than welcome to bring them in. But it is too because we're a student organization on campus targeted towards students. And so far we've received a great turnout. So.
Awesome. So if someone's interested in that, how do they sign up? How do they get involved with that?
Well, they can first start by liking us on our Facebook page, Generation Action, which is where we do share a lot of our events. If they are specifically a student at Boise State, they can access our OrgSync page, which is where we have our registration form. And also they can contact us directly. Our emails are provided on that OrgSync page. And they can also go through the Student Involvement and Leadership Center to contact us directly.
Okay, awesome. And you mentioned workshop. Now, I've taken workshops as classes. This is not a 4-credit thing, is it?
No, it is not yet. Maybe in the future it would be, but we wanted to kind of test it out a little bit and see what the need is on our campus, and maybe in the future we can work with Boise State in trying to offer credit to students for taking these workshops.
Awesome. Well, moving on a little bit, what are some myths, that people have in their heads about Planned Parenthood that maybe they don't know the whole truth or the real facts to it?
I actually don't want to perpetuate those, to be honest with you. I think it's more important that people have accurate information in their heads about Planned Parenthood.
Right.
We have a very strong presence in Idaho. We have 3 health centers, one in Boise, one in Meridian, and one in Twin Falls. In 2015, we served over 7,000 unduplicated patients and provided over 13,000 health services to those patients. A strong majority of our patients come through our doors for preventive services, things like those STD and STI screenings, birth control and family planning, cancer screenings. And I think it's important to note that 70% of our funding comes from patient services. So when people are out there, on news stations and things like that talking about defunding Planned Parenthood, that really is a misnomer, because there's no one way of defunding Planned Parenthood. And when people are talking about defunding Planned Parenthood, what they're really talking about is preventing our patients from being able to access health care. The bottom line is that if Planned Parenthood is in fact cut off from the Medicaid program like they're talking about, or have Title X funding taken away, some of our patients do run the risk of having to go without care. And that's really what we're trying to prevent here.
Mm-hmm. So I'll just go ahead and say, some myths that people are talking about right now, maybe it's just a rumor. Do you guys actually provide prenatal care?
So I know the video you're talking about. It's put out by Live Action, which is an organization with the sole purpose of kind of undermining Planned Parenthood and putting out false information. Okay. To discredit the really important work that we do in communities across the nation. Those videos are heavily edited. They're edited to be purposefully misleading at best and outright lies at worst. Mm-hmm. Planned Parenthood does provide prenatal health care. We're very transparent about the services that we provide. Each health center is a little bit different across the country as far as what services are provided at each specific healthcare center. Mm-hmm. And our goal is definitely for a patient to be able to come in, and if that patient is seeking prenatal health care, we would provide that first screening. We'd provide that prenatal assessment and education about furthering the pregnancy, and then refer her out to an appropriate provider in her local community to be able to receive care for the duration of her pregnancy. Mm-hmm.
Any comment on that? Have you seen this video?
I personally haven't. I don't, for me personally, see the purpose in watching because I know the importance of accessing medically accurate information, and I think that Mistie Tolman put it perfectly, and really that our goal is to make sure that every person in our community receives the access to the care that they want and that they deserve. Mm-hmm. And that's one way of Planned Parenthood doing it for women who are experiencing a pregnancy.
Mm-hmm. Well, we just have a few more minutes, and I just wanted to ask, what's going on in the future? Do you have specific plans for how you're going to get these bills passed, or just what are you guys looking forward in this, right now what's going on crazy in this presidential election? I just want to know what you guys' plans are for the future.
Well, it's hard to know what our exact plans will be because a lot of it is going to depend on what happens nationally and federally. Right now, I think we are kind of settling in and gearing up for, quite honestly, the fight of our lives. And because of that, we're definitely asking our patients, our activists, our supporters, our staff, our donors to stand with us and to take action themselves. And there's a variety of ways that people can take action. And part of what Planned Parenthood Votes Northwest and Hawaii does is kind of help set up those opportunities for people to be able to take action easily. So one thing people can do is make sure their voice is being heard. They can make sure that they're out there signing petitions. They can send letters to their U.S. congressmen. They can send letters to their local representatives. They can show up at the State House and request meetings with their local representatives. Mm-hmm. They can make phone calls. They can, we have a lobby day in a week and a half where we're bringing a group of students and a group of adults who want to make sure their voice is being heard, and we're going down to the State House to talk to their representatives. And it's more important than ever that we make sure that those voices are heard. People can request to have coffee with their representatives because it's their job to represent you, mm-hmm. and it is your right to have your voice be heard about these important issues. Another thing that folks can do is really stand up for your community. I think right now we really need to be getting to know our neighbors, talking to each other and finding out what we each need, and then becoming an ally for that. You know, volunteering with organizations in your community that are fighting for these important values. I think it's going to be more important than ever that we come together and create kind of a bigger us or a bigger we than we've ever seen before. And we can only do that by reaching out to one another and holding each other up during these times. Another thing folks can do is donate. At PPGNHI, we created an emergency patient fund, and we're definitely encouraging folks to donate to that fund. And then really, in 2017, I think it's going to be more important than ever that people get care and that they're practicing the act of self-care, because we all need to be, you know, healthy and energized for this fight ahead, because we're not going anywhere.
And what about Generation Action? Are you guys doing anything in the future that you can talk about right now?
Yeah, definitely. We are also involved in the lobbying day where we'll be going and talking to our legislators, and I think that's a really great opportunity for students as well to get their voice heard and to also let their legislators know what kind of care they're needing, the importance of that access. And also we'll have, like we talked about before, the workshops. We're going to have 2 more in this upcoming semester. And so we hope to continue those. And Generation Action also, like we said before, is really trying to join and collaborate with other groups on campus to really show that we are welcoming and accepting of diverse students. And we want to ensure that everyone feels united and that everyone feels supported on our campus. And they can do that by finding us and contacting us and joining our meetings.
Generation Action is a really, really great resource for students on campus at Boise State.
Awesome. Well, I appreciate your time. I just want to say thank you again to my guests, Mistie Tolman and Michaela McQuilkin, for joining me today. I'm Jamie Bingham, and from everyone here at University Television, thank you for watching.